Hello friends, today we are going to revise dermatology. So first is the trichotillomania. This is the alopecia in vertex. This is non-scarring and there is a perifollicular hemorrhage. So this is very important points. So trichotillomania मतलब कि बाल नोचने की आदत. Okay, so there will be perifollicular hemorrhage present. So this is one of the psychiatric conditions of impulse controlled disorder. Here no exclamation mark here is seen. Okay, here is a Eldritch sign, tonsure sign, Friar tuck sign. All these sign, all of them are same is seen. Now next one is a Sirengoma. This is benign tumor of sweat gland. So female is more vulnerable to this condition. It is also known as a syringosystoma or hydrodenomis eruptis. Hydrodenomis eruptis. Okay, this is a bilaterally symmetrical condition. It affects adolescents. Okay, and treatment is carbon dioxide laser. Okay, diathermy can be done in this condition. Okay, next one is PV, pemphigus vulgaris. Here the row of tombstone appearance. So here is the tombstone. Okay, tombstone, row of tombstone appearance. So tombstone is what here? The basal cells. This is the suprabasal splits, and basal layer is adherent to basement membrane. So okay, Buse line. Next point, Buse line. We see here U. So nail will have depression just like U, and it is a transverse groove on nail, and this is the manifestation of a systemic event like MI, measles, mump, and pneumonia. Okay, next one, Mies or Eldritch line. This can be seen in arsenic or lithium poisoning and renal failure. Wood's lamp examination of erythrasma. It shows a coral pink appearance. And what is the cause of this erythrasma condition? This is Carinobacterium minutissimum. It is associated with diabetes, immunodeficiency condition, obesity, and poor hygiene. So Wood's lamp examination of erythrasma will show coral pink, and this pinkish appearance is due to presence of coproporphyrinogens 3. Okay, next condition, we see this parasite. This is the hookworm Encyclostoma duodenalis, also known as Necator americanus. So filariform larva is the infective. So it pierces skin and will look like this. Okay, look like this. And egg in the stool is appear this one or this one. This is known as the cutaneous larva migrans. Okay, so this condition, the treatment of choice is ivermectin. Now the next one, this condition is the melanosis. This is the flat brownish irregular. This is if it is a familial melanoma, then 40% are associated with a SERCAN2A mutation. Okay, CDKN2A mutations. This is located on chromosome 9p21. Okay, this gene, if mutated, there will be problem of forming tumor suppressor proteins. So what is the function of this gene? It produces p16 and p14. Both of them are tumor suppressor proteins. P16 also known as INC4A, P14 also known as ARF. Okay, P16 act on retinoblastoma, this RB gene, and this on P53, 14 on P53. Okay, next one is the acantholysis. So this is the loss of intercellular connections such as of desmosomes. So desmosomes, it can be the primary, it can be the secondary one. So primary is pemphigus vulgaris, staph scalding skin syndrome ऐसे है. So diarrhea syndrome, Hailey disease. Secondary is the zinc cell is formed first in this condition. So this is usually in infection, varicella zoster and HSV1 and 2. Ballooning is present here. Okay, but in bullous pemphigoid, in this condition BP, there is no acantholysis. Acantholysis is not present in BP, bullous pemphigoid. Okay, now next one. Most common type of psoriasis. Most common type of psoriasis is plaque psoriasis, also known as psoriasis vulgaris. So this is the image of plaque psoriasis. Here the internal is the plaque and the outer is the clear zone. This clear zone is known as ring of Voronhoff. And most common site of this plaque psoriasis is scalp. Next one. In a normal person, hair cycle 80 to 90% consists of anagen. So we have 3 stage. Hair cycle has 3 stage, A, C, T. So anagen, then catagen and telogen. So 80 to 90% of hair are in anagen condition. Telogen is the last shading stage. It is known as exogen process. And in anagen, too much mitosis is going on. Okay, next one. Tinocynovitis with dermatitis and migratory asymmetric polyarthralgia. This condition is presented in disseminated gonococcal infection, and it is spreading through hematogenous spread. Okay, next image we see this tip of nose is got touched by the tip of tongue. This is the Gorlin sign present in Ehlers-Danlos syndrome. Next, this is the incontinentia pigmenti. This is the rare X-linked dominant skin condition in which multi-system ectodermal dysplasia is seen. Okay, this is lethal in male, and cutaneous manifestation is along with line of Blaschko's. Okay, here the 60% patient is neurologically normal. Okay, next one. What is this? Groin area itchy. So itchy annular plaque in groin. Itchy annular plaque of groin on corticosteroid get worse. So this is the tinea cruris. This condition is the tinea cruris, one of the dermophytosis, and it is caused by Trichophytum rubrum and Epidermophyton floccusum. So this has to be treated with terbinafine, itraconazole, fluconazole or griseofulvin. DLE, next condition, is the discoid lupus erythematosus. This is the on face we are seeing that this hypopigmentation at central, hypopigmentation at central and hyperpigmentation at border. So this is treated with HCQ, hydroxychloroquine. Okay, this is one of anti-malarial drug. This is first line treatment of this condition, DLE. Okay, other things can be used, that is a topical or intralesional steroid, but we are not giving systemic steroid. Topical retinoid can be used, but the drug of choice is HCQ. Next condition. So this is the patient is showing his tongue, and here is the loss of normal topography of tongue. This is the atrophic candidiasis. So patient is taking steroid, inhalation steroid, history दिया गया है inhalation steroid for long time for condition just like asthma. So patient will get can get it candidiasis, and this candidiasis will cause loss of lingual papillae, So condition will look like this: arithmetis or atrophic candidiasis. Next condition. This condition is got on sun exposure से आ रहा है. Prolonged sun exposure is causing something lip condition. This is actinic cellitis. This is the pre-malignant keratosis. It is also known as cellular lip or solar chiliosis, and it is treated with 5% fluorouracil, topical tretinoin or laser ablation. So what is the protection not to get such condition is the applying sunscreen lip salves that contains p-aminobenzoic acid. Next condition, we see there is the subungual melanosis, blackish color. This is painful and swelling is present. This is the Hutchinson sign. Okay, this is melanonia, subungual melanoma. Sorry, पहले मैं melanosis बोल गया. So correct word is the subungual melanoma. Okay. Now the next condition is the this patient is getting such a kind of, I think, wheel hai kya. So this is the acute eczema, dermatitis. Oh, this is and here is the histopath of acute eczema. We see among between the cell there is a lot of spacing. This is filled with fluid, so intercellular edema is present in this condition, and which layer in the stratum spinosum, also known as spongiosis. And in the other condition, infectious conditions like herpes infection, intracellular edema is present, and it's also inside is stratum spinosum. Acantholysis is seen in herpes infection, and ballooning degeneration is noted. Okay, next and last condition is this one. This is the photo patch test. Diagnosis of photoallergic contact dermatitis, and test is right after 48 hours और skin and light source के बीच में 15 centimeter distance is manage for you. Okay, UV source. And positive reaction shows type 4 hypersensitivity reaction. So thank you friends.